With cases of COVID-19 rising locally as well as nationally, and some of the new vaccine mandates that are starting to show up across the country, I've been spending a lot more time with my patients talking not only about the vaccine, but also about treatment of COVID-19 itself. So I thought I'd put together this video and go over some of the most common questions that I've been getting asked recently. The most common question that I get asked, almost rhetorically, is, do you recommend the vaccine? Absolutely. I feel that the vaccines are safe, definitely effective, and I've yet to find a patient who actually has a contraindication to the vaccine. Currently, the only listed contraindication to the vaccine, according to the CDC, is someone who's had an anaphylactic reaction to the vaccine or one of its components. Thankfully, I've not run into any patients who have had an anaphylactic reaction to the vaccine. So absolutely, yes, I recommend the vaccine. I've also not encountered a patient who actually has a condition where I would recommend they not get the vaccine. I'm sure there are some of those out there, and I highly encourage you to talk with your provider if you question that. But I personally have not run into someone. In fact, usually the people that ask me that question are those that have medical conditions that make them high risk for developing severe COVID-19 anyways, in which case they absolutely should get the vaccine. The next most common question I get is, are these vaccines safe? Absolutely. These vaccines have been scrutinized and studied possibly more than any other biologic or medication out there. We have run across a few severe side effects that have been attributed to the vaccine. I made a separate video on that, and I'll link it up above for you to check out. That goes through some of the severe side effects that we have attributed to the vaccine, but it's important to note that those severe side effects also happen with COVID-19 itself at a much higher frequency than they do with the vaccine. That question is usually followed by, well, how do we know that the vaccines are safe long term? Well, if we look at the history of vaccines, there's never been a severe side effect that has not shown up within 8 weeks of a person receiving the vaccine. Now, the rebuttal here is, well, this is new technology. How do we know that won't happen with these? Well, if you think about it, every vaccine that we've had over the history of time has behaved the same way, and the technology's been new at some point. So we feel very confident that we're not going to see any long-term side effects. It's also important to note when you're comparing potential long-term side effects of a vaccine to what you may have heard of or experienced with potential long-term side effects of a medication, in that you don't take a vaccine every day like you take a medication. You have continued repeated exposure to a medication that could potentially develop into severe side effects long term. However, with a vaccine, you're giving the injection. The substance, in the case of the COVID-19 vaccine, lasts a matter of days to maybe a couple of weeks, and then it's gone. So there's limited ability for the vaccine to even cause severe side effects because it doesn't stick around in the body that long. Next question I get is, well, will I get sick from the vaccine? Possibly. Most people, if they're going to have a mild reaction to the vaccines, have it after their second dose if they're getting one of the mRNA vaccines, such as Pfizer or Moderna. Now, the caveat there is if you've had COVID-19, you may have some mild side effects after the first dose. If you think about it, that's because your first dose is actually acting as a booster because COVID-19 was your primer. If you've never had COVID, then the first shot's a primer, second shot's a booster if you're getting one of the 2-dose vaccines. So you're more likely to have side effects after the second dose. Now, those side effects in general are just your immune system responding appropriately to the vaccine. You might have some fever, chills, sweats, headache, etc. Usually that's only going to last a few hours to maybe a day or two and is usually easily treated with Tylenol, ibuprofen, and some rest. Probably one of the more contentious questions I get asked is, can you get COVID if you've had the vaccine? Now, in order to answer that question, we have to think back to what the original intent of the vaccine was. Unfortunately, the original intent of the vaccines was never to prevent you from getting COVID. The original intent of the vaccines was to prevent you from getting severe COVID and getting sick enough to end up in the hospital and possibly die. Even against the Delta variant, these vaccines are doing extremely well, 90+% effective at keeping you from getting severe COVID and keeping you out of the hospital and keeping you from dying. Now, where they have fallen off a little bit is their ability to prevent you from getting sick in the first place. But that was never the intent of the vaccine anyways. That was actually just a cherry on top. And even with that, they're still doing pretty well at preventing infection, 60+% effective, even against Delta, at preventing you from getting sick in the first place. So unfortunately, yes, you may get sick after the vaccine. However, if you do, you're much more likely to have a milder illness, not last as long, not end up in the hospital, or worse, die. And we have a recent study showing you're much less likely to have long COVID symptoms. So still plenty of benefits from getting the vaccine. Don't let people try to convince you that just because the vaccines can't prevent COVID, they're not useful. That's not the case. If I've already had COVID, should I get the vaccine? Now this one's a little harder to answer, I'll admit. Because after you have COVID, your body does develop an immune response to that virus and offers you some protection for the future. Where things get a little murky is how well that protection works against future variants, how long that protection lasts, and unfortunately, we don't know the level of immunity that you actually get after a COVID infection. So currently, it is still recommended that you get the COVID-19 vaccines, even if you've had COVID. Now, when can you get the vaccine? This is also a little controversial. You'll get different answers from different providers. The CDC actually states you can get the vaccine as soon as you recover and are feeling better. I know some providers will recommend waiting 30, 60, maybe even 90 days after the vaccine. There's really no great evidence that says you have to wait a specific length of time other than you want to be feeling better. Now, the only caveat to that is if you've been treated with one of the monoclonal antibody treatments, or if you've been hospitalized and received some of the IV treatments in the hospital, then you need to wait at least 90 days after you receive those treatments. That's the only hard and fast rule that I've been able to find. So the answer is yes, it is currently recommended that you get the COVID-19 vaccine even if you've previously had COVID. We know that those individuals actually do very well against future infection, probably even better than those of us who have simply gotten the vaccine. The next question that I've been getting asked a lot more thanks to school starting is, should my child be vaccinated? Currently, the Pfizer vaccine is authorized for use in children aged 12 and above. Now, this one's a little bit more controversial too, because with previous variants, children have not gotten sick that much. If they did, they had a very mild disease usually, rarely ended up in the hospital, rarely had severe disease. However, thanks to Delta, that's changing. We are seeing more and more children become ill. We're seeing a lot of those children end up in the hospital. There's plenty of news reports of pediatric hospitals being full thanks to the Delta variant. So, I think it is important that we get our children vaccinated for a couple of reasons. Number one, we're seeing more severe disease, and again, like I just mentioned, the vaccine is meant to prevent severe disease and hospitalization. Also, children are part of the pool that spreads this virus. So if we vaccinate them, we have less of a chance of them taking it home and getting grandma sick or mom and dad sick, who potentially could have more severe disease. So I do think it's important that we vaccinate our children. The vaccines have been shown to be safe and effective in kids. Pfizer, like I said, is currently authorized down to age 12. Moderna has submitted their data and is looking to change their emergency use authorization to a lower age level as well. We should have some follow-up data coming hopefully this fall or winter on even younger population. So yes, I do recommend children get vaccinated. Is the vaccine safe in pregnancy? This one also tends to create a lot of emotion. I understand. I get it. You're pregnant. It's not just you, but it's also the baby that you're carrying that you're worried about. And I completely understand some of the reservations that some of my pregnant patients are having. However, it's also important to keep in mind that pregnancy is actually now considered a high-risk condition for developing severe COVID and ending up hospitalized. Currently, the American College of Obstetricians and Gynecologists, as well as the CDC, do recommend that pregnant women get vaccinated. There has been no clear signals in the data that there's any safety concern regarding fertility, regarding pregnancy, or regarding any harm to the infants. If you are pregnant, though, I do recommend you talk to your obstetrician and get their opinion on your individual case on taking the vaccine. What about vaccine deaths? I don't get this question as much, but I have gotten it some, so I wanted to address it. Usually, individuals, when they ask this question, point out what they've heard or what they've been told about the VAERS data showing that there's been over 6,000 people die after getting the COVID vaccine. Now, you do need to understand a little bit where the vaccine adverse event reporting system data comes from. The VAERS data is simply individuals going to the website or calling in a report that they've had some sort of adverse event, whether it's a side effect or whether it's death, after receiving a vaccine, in this case the COVID-19 vaccine. Unfortunately, that quote of 6,000 plus individuals is unverified data. To my knowledge, there's only been a handful of deaths actually attributed to the vaccine. Now, let's put that in perspective. Every death is tragic. However, a handful of deaths after a vaccine compared to the over 600,000 people in the United States alone that have died from COVID-19 is pretty tragic. I usually also mention that, unfortunately, with many of those deaths that are reported to the VAERS system after receiving a vaccine, that correlation does not equal causation. And what I mean is that, unfortunately, because of an aging population, because of comorbid conditions, because of whatever happens to that individual, someone is likely to die after receiving the vaccine. That doesn't mean they died from the vaccine. So please be careful if somebody tries to scare you out of getting the vaccine. All right, let's move on to some of the questions that I get about treating COVID-19 itself. First question is, are there any treatments available? The answer is yes. If you qualify, we now have monoclonal antibodies, which are laboratory-created antibodies that you can be given through an IV infusion to help you fight the infection. Thankfully, I've now treated many patients, both those that have been vaccinated and unvaccinated, with monoclonal antibodies, and I've yet to have a single patient end up in the hospital after receiving the monoclonal antibodies. A couple of the other treatments that are available if you happen to get severe disease and end up in the hospital is a medication by the name of remdesivir, and you're also likely to be given dexamethasone, which is a steroid to help tamp down your immune system, because usually when you're in the hospital and suffering from severe disease, part of the problem is your immune system's on overdrive and it needs to be slowed down a little bit. The next question's on a lot of people's mind these days. If I get sick, will you treat me with ivermectin? The answer that I give currently, based on current research, is no. Why? Because I don't believe there's enough good quality evidence that shows that ivermectin is safe and or effective for treatment of COVID-19. Now, there are some ongoing clinical studies looking at the treatment of mild to moderate COVID-19 with ivermectin, and I really hope those studies come out very soon because I'm getting so tired of this debate. I'm seeing a ton of people trying to go to the feed stores and buy ivermectin and then asking me how much they should take. I'm going to tell you don't take it. Common rebuttal is, but there's other doctors in the area that will prescribe it for me. Well, my opinion is those other doctors are standing on thin ice because there's just not good quality data that says ivermectin really does much of anything for COVID-19. Many are quick to point out some of the meta-analysis and studies that have been shared widely around the internet. Unfortunately, most of those studies, if not all of them, are either extremely small, not powered enough to really make any decisive conclusions on, have flawed data, or are significantly biased. What that means is the study is designed to give the answer that the researcher wants it to. Of course, those studies are going to have a positive outcome. They're biased. So until I see a good quality randomized controlled trial, which there are some ongoing right now, I'm not going to be prescribing ivermectin for anybody. If one of those quality studies shows that it's safe and effective, sure, I'll prescribe it, but not right now. And then lastly, I've been asked a handful of times, what about vitamin C, vitamin D, zinc? There are some doctors out there that recommend these. I've looked into this before. I did a previous video on vitamins and COVID-19. I'll, again, link to it up here. As of the time that I made that video, and I'm not aware of anything newer, there really haven't been any studies, again, that have shown that vitamin C, zinc, vitamin D are effective at preventing or treating COVID-19, with one potential caveat for vitamin D. If you have a low vitamin D level, then taking vitamin D might help. All right, that covers some of the questions that I've been asked recently about the COVID-19 vaccines as well as COVID-19 itself. If you have any additional questions that I haven't covered, please leave me a comment down below and I'll be happy to try to answer them. Please like this video, it helps other people see it. And as always, stay safe out there.